Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq. Joining us for this segment, we have Dr. Joshua Hare, co-founder of Nasdaq-listed Longeveron, to discuss COVID-19 therapeutic treatments and the path of potential variants. Dr. Hare, it's great to have you with us. Welcome to Trade Talks.
Thank you for having me.
You got it. And as COVID-19 changes, we have to change strategies, and it's necessary to have therapies directly for the consequences of the disease that are independent of the variant. Tell us more about that.
Absolutely. We've seen the variant shift so many times. We need something that can treat any variant and the consequences thereof. So our product at Longeveron is based around treating the cytokine storm. And regardless of the variant, if there's a cytokine storm, that can be treated with our product, Lomecel-B.
And what does this mean for the healthcare sector? Are we better prepared to manage COVID at this point?
We are so much better prepared because the technologies, the antiviral drugs and the vaccines are a quantum leap improved from where they were before COVID. The one gap is the treatment for the cytokine storm, regardless of the variant causing it.
So where does Longeveron fit in the healthcare ecosystem?
We're a biotech startup, and our product is based around a medicinal signaling cell. It's a cell that comes from the bone marrow. It used to be called a mesenchymal stem cell or mesenchymal stromal cell. And this cell can modulate the immune system in such a way that it can shut down a cytokine storm and improve vascular function through a damaged organ. So
is this therapy taken when you have COVID, or is it a preventative medicine?
We're doing our product is designed around treating older people, diseases of aging. And one of the biggest problems in aging is a depression in the immune system. You see the death rate from COVID was the highest in older people older than 65. We can't say for sure now whether our product would enhance the immune system, but we have early exciting data that it might, and we're testing that in an additional clinical trial, the results from which we should have later this year.
And we'll get to your pipeline in just a moment here, but explain to me what makes this therapy unique.
It's unique because it's a living human cell, and our product is also unique because it can be used as an off-the-shelf product. So we can make it in advance and have it ready to treat hundreds of thousands or millions of people. So it's basically a drug that's made out of a cell. And this is a new concept in therapeutics now, to use cell-based therapy. There are examples of this out there, very few. CAR T therapy is an early example of a cell-based therapy.
And Dr. Hare, to wrap up here, give us an update on your pipeline and the outlook and when these could potentially be available for commercial use.
We're very excited about two elements in our pipeline, but we actually have three. We're excited about our program in hypoplastic left heart, which has had a successful phase 1 study. We're very, very excited about our phase 1 results for Alzheimer's disease, and we are already enrolling in a phase 2 study. And one of our biggest studies is in a group of individuals who have aging frailty. And that is in a subgroup of those, we'll be looking for the effects on the immune system. Finally, we do have a study to look at patients with COVID who have COVID pneumonia due to that cytokine storm.
All right. And Dr. Hare, we appreciate the update. Thanks for joining us on Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.
Thank you for having me.